Hi, my name's Melissa. I'm the Technician Training Coordinator for the program. This is our classroom where the students complete their PTU didactic modules. Each student is assigned their own dedicated workstation. The classroom is equipped for 6 students. The expectation is that students work through the didactic material during their assigned classroom time under my supervision. I sit at the desk in the rear of the classroom. I'm here to address any questions the students may have while working through their material. I am also able to monitor their progress and performance real-time through PTU. I can provide real-time additional support to any students that may be struggling through modules. The classroom is also set up with a projection screen in the front. This allows me to share my screen while I'm teaching material. It also allows for speakers to present materials and facilitate discussion with students remotely if necessary. As students reach the embedded simulations within PTU, I am available on demand to proctor and evaluate each student's simulation exercise individually. To do this, we move to the simulation lab, which we will see next. This is our simulation room, which is next door to our classroom. It's a space that's outfitted with tools and equipment to allow students to effectively complete their simulation exercises within the PTU curriculum. Additionally, we've integrated much of the technology that our pharmacies utilize in a day-to-day practice. This allows us to provide students with basic training in these applications before they set foot in pharmacies to begin their experiential hours. We have multiple computer workstations available for students to practice their data entry, processing, and outpatient prescription information. In addition to accessing the PTU curriculum, these workstations are equipped with EPS PDX, which is the pharmacy software that Gunderson outpatient pharmacies utilize. When completing simulations that involve preparing medications for dispensing, we have shelves containing bulk containers of mock medication from which the students need to select the correct product to complete the simulation task. We have supplies located in this area, including counting trays, vials, and bottles. Our non-sterile compounding equipment includes a scale and compounding slab. We keep non-prescription bulk ingredients on hand that we utilize when teaching and simulating simple non-sterile compounds. We also have a reconstitution station.
My name is Barb Ransberger, and I am the IV specialist here at Gunderson. And I am the lead faculty member, and I teach our students about sterile compounding. Some of the content that I teach them about is proper hand washing and garbing, aseptic technique, first air, how to work within first air, and the basics of sterile compounding. In the simulation room, we have installed a decommissioned biological safety cabinet. This allows us the opportunity for students to practice sterile technique and manipulations in a physical environment that is very similar to what they will see within a hospital setting. I explained the difference between a horizontal laminar flow hood and a vertical laminar flow hood, and which types of sterile compounds are mixed in each type of hood. When completing the sterile product simulation, the students work within the hood. In addition to being a safe space in which they can demonstrate the basics of working in a sterile field, we use expired medications so the students can gain practice and experience within manipulating a syringe, reconstitution, dilution, and transfer of solutions. Our sterile compounding curriculum is not designed such that a student is practice ready upon program completion. Any student placed into a technician role at Gunderson that includes IV preparation in their responsibilities will receive further on-the-job training and competency evaluation. However, this introduces the basic concepts to all of our future technicians and helps us to see which students might be a good fit for practice in a hospital setting.
This is the hospital pharmacy at Gunderson Lutheran Medical Center. It services the 325-bed hospital care units and hospital outpatient departments, including our regional dialysis centers. It is staffed with a minimum of 1 pharmacist and 2 pharmacy technicians 24 hours per day, 7 days a week. Technicians cover day, evening, and overnight shifts, and during the students' 3-week experiential block in the hospital, they rotate through both the day and the evening shifts to observe and work within the workflows at different times of day. There are 5 storage locations for medications in the central pharmacy. Most medication stock is located in one of 3 carousels, but we also have medication stored within other technology, including the EXP packaging unit and C2 safe, refrigerators and freezers for cold storage, and remote shelving. We employ a system called RxWorks to help keep inventory of our medications. RxWorks interfaces with our system's electronic health record as well as our storage software. Technicians work within RxWorks to select the correct medication product for both patient-specific and bulk medication orders. Before any medication leaves the pharmacy, its barcode is scanned and double-checked versus the original order to ensure accuracy and integrity of the product. Medications on the patient care units are stored in a combination of secured, patient-specific nurse servers and Pyxis automated dispensing units. Pharmacy technicians are responsible for medication management within both platforms. We have a dedicated area for non-sterile compounding, in which bulk and patient-specific compounds are prepared by pharmacy staff. We also have a USP-compliant sterile products area that includes an ante-room for garbing, hand washing, and product pre-mixing preparation, a mixing room with 3 horizontal laminar flow hoods, and a separate mixing room with a biological safety cabinet for mixing cytotoxic and hazardous medications. Gunderson's East Building Pharmacy, which is located on the main La Crosse campus, is one of 10 outpatient pharmacies within Gunderson's Pharmacy Services Department, and one of 4 locations in which our training program students complete their outpatient experiential training.